Justin is speaking from the Philippines, and Aaron is speaking from Kaduna. Am I correct, Aaron?
Yes, Kaduna, Nigeria.
Okay, that's fine. Okay, so I want this to be a free conversation. I want it to be like an open space where we can just have this conversation for like up to 30 minutes or 40 minutes, and that's fine for us. So I'm going to start by asking about the situations around your area regarding COVID-19. So it can be like a kind of let's just start with that. What's the situation in your area, Justin, with COVID-19? Is everybody back to normal now? Is everything back to default? Are people moving? Has COVID gone? What's the situation?
If you're asking about the Philippines, no, we're still in the same countrywide lockdown and the usual quarantine measures. But I think regionally in the rest of Asia Pacific, it really differs because some countries are reporting no new cases, so are starting to go back to their normal kind of lives. But yeah, it really depends on the country. But in the Philippines, where I'm from, we're still we're still in our and still in lockdown mode basically.
Oh, wow. Okay, Aaron, could you share your experience with us?
Well, I think with regards to specific Kaduna State, I think aside March 24th, that the lockdown was enacted, and later around
I can't hear you. We can't hear you, Aaron.
Can you hear me clearly now?
Exactly, yes.
All right.
Exactly,
So
yes.
what I'm saying is that, yeah, with regard to Kaduna specific, earlier around March 25th was when the lockdown was enacted in the state, and I think as around June ending or so, there was a little bit free for the people to continue moving. But in regard to the situation, Kaduna is currently among the top 7 high burden states in Nigeria with regard to COVID, with
Oh, wow.
2,500 current active cases.
Oh,
Yeah, so the state, despite the lockdown relief, the necessary NCDC measures are still being followed, the wearing of face masks and all that. So, but life have returned to normalcy.
all right, that's good to know. Thank you so much for sharing your experiences. So let's get into the business of the day. So as we all know, tomorrow is World Mental Health Day, and we are all most civil society organizations or most organizations and institutions around this sector are working towards raising awareness and putting up like an extra advocacy strategy, especially to create a mild tension about what mental health is all about. So I would like to hear from Justin. When Alicia shared a report that you worked on regarding mental health and young people. I don't know if you want to share that with us at this point.
Sure. I mean, apart from that, I think it's also I'm super excited about the collaboration with the PAC, for example. I mean, as you said, that tomorrow is the World Mental Health Day, and I think the World Health Organization, in particular, is highlighting the need for civil society to, you know, to hold states accountable about their commitments to mental health, because I feel like, we cannot achieve physical
Mm,
health, even sexual health,
yeah,
sexual and reproductive health, if we do not look into mental health. So, for
exactly.
example, for our work,
Mm,
we recognize that marginalized groups, young key populations, are affected disproportionately by COVID-19 already. So, if you look at it under the dimension of well-being and mental health, everything is just, everything gets, you know, the compounded
Yeah.
the levels of stigma and discrimination already faced for someone who identifies as LGBTIQ, for example, or someone who's living with HIV, and then you add, they can't access their services, their ARVs, their medication, their testing, their treatment. Um, and then plus the fact that the COVID-19 preventive measures by countries such as quarantines and lockdowns are preventing us from going out of our houses. So the lack of mobility is affecting everyone, and it's increasing the anxiety and stress and depression of a lot of young people. So I think just just putting that into consideration, this World Mental Health Day, it's important to note that COVID-19 uh, really exacerbates mental health issues and other issues as well. And I think our report, which I invite everyone to check
Yeah.
on, really highlights that, especially for key populations like LGBTIQ and
Okay.
people living with HIV.
Mm. Okay. Okay. That's fine. Thank you so much for sharing, Justin. Yeah. I hope you can hear me. Aaron, are you there?
Yes, I'm here.
Okay. So you said you told us that you're working on something that is on the like that is still on installing or something that's still in progress. And it has to do with it has a bit of mental health issues. I do
Yeah,
not know
definitely.
if yeah, can you also share that with us?
All right. So with the impact of COVID, with the impact of COVID, especially among adolescents and young people living with HIV, the global network of young people living with HIV plus saw a need to really deep dive to find out how really does this COVID impact young people, especially around access to their health and other psychosocial services. So we are about doing a national consultation and
Mm,
case study, and
yeah,
this is a project that is going to be in 3 countries: Chile, Eswatini, and Nigeria.
yeah.
So the idea around it is to engage young PLHIV and also conduct some in-depth interview with peers who have passed or are currently passing through some mental health issues. Because
Mm,
one of the things we observe, especially during that period lockdown was happening, many young people were depressed. Many young people, the anxiety was quite much because of the rate at which COVID was becoming more spreading, and the fear to even go to facility because of the death of some of the healthcare workers due to COVID has also affected. So many of them like fall under mental health
issues.
situations and could
Yeah.
not even go access some of the psychosocial support and the
Mm.
like. So that's why we saw a need to say, okay, let's deep dive and engage some of these young people to really understand and see how best services can be tailored and supported.
All right, thank you. So, Aaron, do you think mental health is a problem in Nigeria?
Well, I will say it is. It is because I can say we have an estimated population of about 200 million, but I can assure you the number of psychiatrists, like the trained psychiatrists, doctors, and the likes, are not more than 300. They are not more than 300. And some studies have estimated that at least 80% of persons going through mental health situation do
Mm,
not get to access the services.
yeah,
So
that's correct.
definitely Nigeria, due to even other issues affecting the country, let's even put health perspective aside, this terrorism, kidnapping, and other things, the lack of job, employment, the fear of livelihood, and the rest. So you can see it's physical because many a times you even know that you even read that many people jump from Third Milan Bridge in Lagos because one way or the other
Yeah,
they feel depressed.
that's
That's the
true.
one,
That's
because
true.
probably someone, so it's quite rare in the country. It's quite rare.
Okay, thank you so much. So I'll be moving to Justin again. So Justin, I would like to ask you if You think mental health is like, do you think it's an emergency in your location? Do you think it's an emergency in your region?
Yeah, I think definitely across the world.
Mm,
Um, However, people don't see mental health as a priority. It seems to always be an afterthought. You know what I
yeah.
mean? Like everything comes before mental health. Like, I understand that there's, we work on SRHR, on human rights, on
Mm,
all these other things, but I think we should always you should always put self-care, well-being, and mental health in every
yeah,
aspect of our work.
aspect of.
So yeah, yeah.
Okay, so I was also going to come from the government perspective. What do you think government is doing in relation to mental health? Do you think that there should be more attention, and are young people actually pulling situations that increase attention? Do you think we should do more on maybe advocating for mental health attention? Do you think something needs to be done? What exactly might be the problem that the government is not paying attention yet? Or if they are paying attention, what's the level of the attention that they are paying to issues around mental health?
So is it to me or is it to
Yeah,
Jenny?
Justin can answer.
All right.
Sure.
Justin,
Well, mental health is a human right. Let's agree to that. I think mental health is a human right, right? Um, Therefore, I think states are committed to fulfilling that the human right to mental health, basically. So, but it's also our role as young people to lobby for it, to lobby for
exactly.
positive laws,
Mm,
yeah, for legislation, for the enaction of legislation,
mm,
and to be part of whatever process is available to to push for mental health. I think even the SDGs, Sustainable Development Goals,
mm.
allows us to also advocate for mental health. If we're talking about the SDG for health, or the SDG for education, or the SDG for reducing inequalities. So I think it is there. It's in the SDGs. It's in human rights framework. There, the human right to health, for example, should include the human right to mental health. So I think it's there. It's possible to work on this with governments as our allies, and it also should be the government's role to as their commitment to that human right. Yeah.
Yeah, so what's the situation in your location? Do you think that the government is actually paying attention? Oh,
Yes, 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 in a way, because I think in the Philippines, for example, the Ministry of Health is
yeah.
taking proactive steps in, for example, awareness campaigns,
Oh, that's nice.
uh,
Mm,
yeah, materials that are youth friendly and appropriate, that talk about mental health. They support civil society to engage on mental health. But one thing I think is lacking is the innovation on mental health. The innovation. What I mean about that is
yeah.
COVID-19. COVID-19 has brought us into the virtual world. So I think the mental health services should also adapt to that. So I think there should be more investment, for example, to allow mental health professionals to uh, address their clients and patients over the internet, for example, if that's possible, to provide guidance and counseling
Mm,
online. That there should be opportunities and platforms for mental health professionals to remain connected with their clients, because sometimes we can't go to our psychiatrist, we can't go to our counselors. So that, we could at least call them, or have a
yeah,
virtual consultation. You know what I mean? So I think there should
exactly.
be investment around that as well.
Okay, that's cool. That's cool. Thank you for your suggestions and recommendations, Justin. So, Aaron, I think you can also answer the same question that I've just asked, that Justin has answered. Yeah, so we can we can do a comparison between Nigeria and Philippines, or Africa and the Pacific. Yeah, are you still there, Aaron? Hi, Aaron, can you hear me?
Yeah, can you hear me?
Yes, I can.
All right. So I think if you say the government, Nigerian government at initial stage, I would say we are committed because I remember way far back in 1916, the lunatic order was signed, which was more like a government policy to look into the issue of mental health that affect people. And when you come back to 1956, it was addressed, letter amended to Lunatic Act. And as far as 2013, it now became the Mental Health Bill or Act also. And early 2015, the policymakers, like the legislatures, try to say, okay, how can human rights component be prioritized within the bill itself, so that while we are providing services for individuals that are under mental health issues, their rights are not being violated. But I think that was at the same process where we couldn't get a better stride because the government couldn't get to approve that bill. Rather, they came back at early at 2018 with the National Mental Health Service Delivery Guideline. So a guideline came in for services to be delivered, but rather it should have been something that also factor in the right component of the client. So the government are doing in terms of, because what I believe is that if we have a policy framework, other things falls into place. So government have tried to give us, okay, at most we have a service delivery guideline, and also they recognize mental health within the law. So, but what I think we need to do more, especially for young people, is to start raising these voices around issues facing young people. Because when you talk about mental health, many a times they do not see the young person falling victim to it.
Yeah.
Yet, if you look at it from the perspective of the stress, depressed, and all those other vices, many of the young people are subject to that these days. So I think it's more of an advocacy, and also trying to see within national plans, within funding and other policy documents, mental health are being prioritized.
Oh wow, that's insightful. Thank you so much for your honest insights, Aaron. Yeah, so I wanted us to have a 25 minutes conversation, but so now we are actually running to close. I was going to ask the final question, and this is going to be like more participatory. So because I'm going to record the videos individually. For example, I would like Aaron to say something about mental health, and then the Mental Health World Day 2020, and then Justin the same thing, but it has to be a recorded video. I need to see your faces. So I do not know if Aaron, I don't know if you're able to do that, or do you want to send me a video later? Or I don't know. I don't know how we can do this. So do you want us to record? Hmm?
I can do that. I'm just stepping out now.
Okay, you can do that. So Justin, I don't know if you're able to do that too.
Yeah, I can turn my camera on.
Okay, that's fine. So okay, maybe I'll go with Justin first. So Justin, maybe I'll go with you. So we can run by.
Well, um, as Youth Voices Count, where I come from, which is a regional network for young LGBTIQ people in Asia Pacific, and we are a member of the Pact. I think our commitment for the World Mental Health Day is to ensure that young key populations, including young LGBTIQ people, young people living with HIV, young sex workers, that their mental health needs are included and that they are considered and that they are acted upon, and that we can find ways to support their needs and lobby to our states to be more proactive in fulfilling their commitments for young people and mental health. That's
Okay. Yeah, thank you so much, Justin. That was quick. So Aaron, I'm coming to you now. Yeah, so Aaron.
Yeah. So as a member of the PAC itself and as the lead for the capacity building working group, as well as the executive director of African Network of Adolescents and Young Person Development, I believe mental health is something that no one can run away from. And it's something that can be of effect to anyone from any level. So with the day for mental health, I'm using this opportunity to call on all government, policymakers, multi-sectoral partners, stakeholders to prioritize the needs of adolescents and young people in their diversities. Young KP, YPL, HIV, adolescent girls and young women, young people living with disabilities, they should prioritize their needs when policies are being designed, when strategic plans are being developed, and when funding are being allocated. We want to see more attention and investment towards mental health because we believe with stability of our psychosocial health and physical and emotional health, there is more that we can achieve. Thank you.
All right. Thank you so much, Aaron. I appreciate. Thank you so much for that kind message. And Justin, thank you so much. I appreciate all your messages. They're so amazing. And I can't wait to use them to create some other information and communication. And thank you so much for coming to the show. And Justin, I will need to leave you to go and sleep. It's past 12 a.m. around you. So sorry for the inconvenience, and thank you for coming at a very short time. So I'm going to turn this into a podcast. Everything's going to be out tomorrow, and then put it out on YouTube and share. And there's going to be a lot of sharing and promotion for some of the promotional materials tomorrow. So I hope you guys also share.
Sure. Thanks, Jimmy. Nice to meet you, Aaron. Good night.
Justin.
Yeah, thank you, Aaron. Bye.
Bye.
Yeah.